So some of y'all that already in my class, you already knew the routine. Get those books out. So I included Facebook on this. All right. So we included Facebook on this. I did not put Instagram and y'all on this because y'all are going to archive. Look how nice Instagram look. Facebook. What's up, y'all? So I sent y'all something, you know, for my Twitter. Make sure y'all highlight my Twitter. Okay. Now my Twitter ain't for class. My Twitter is like political, just conversation where I make comments and stuff. Okay. I'm just trying to make sure y'all can hear me. My mic was a little bit dead, so let me see if we can get it working. So we're going to well, I know we ain't gonna finish because we tried to finish the other day, and I think this is all right now. So if it start blinking, I gotta take it off. So we're gonna try to finish evaluation and management. This class gonna be a little bit lengthy. I was gonna go ahead and start it earlier, but I had already scheduled it. I can't even say it. Scheduled it. All right. So if you guys are not on YouTube, right? You can't see the stuff that I'm putting up, all right? Because it either has to be something in my hand when I'm on Facebook, um, when I do the live on YouTube, you guys can actually see, what I have up there. So when we're on YouTube and we have all our books and this and that and everything, I'm literally guiding them. They have their books already, but I do post my books up so that they can see um, what I'm referring to. Or, I'll have my CPC guide so they can see what I'm referring to. So for this is for you guys for Facebook. So Facebook, you need to run over to YouTube if you want to see all that. If you just want to see, oh my God, what is Miss Lambert doing? And I know a lot of y'all that's already on my Facebook. Now look, y'all, people follow me. People follow me. Now, if you're not my friend, I don't know you. Okay, I don't know you if you're not my friend. So you go ahead and follow me. That's cool. But I still want you to run on over to Twitter and y'all go ahead and follow my Twitter. I'm trying to get my Twitter up. Okay. Um, so I know a lot of y'all don't have YouTube, but still, come on, y'all, hit my YouTube up. I'm trying to get 3,000 hours here, y'all. Okay. So let me see why this one ain't connecting. Hold on. Let me see what's up. Let me see what's going on with this. All right, you got to do all kind of gadgets. This one is on. I know. Y'all know how I do. So this class is going to be a lengthy class. We're going to try to stretch this class to 9 o'clock so we can go ahead and get out of E&M. Let me head on back to OBS. So Facebook, I'm just kind of threw y'all in there in case somebody kind of walking by or somebody kind of scrolling. Okay. Facebook cannot see everything that we can see on YouTube. Okay. This is okay. So it's just kind of left something up there. I think that's cool. So how come it didn't write that before? So I put notes up there for Facebook, but it didn't pop up before. All right. So if I type on Facebook, it'll pop up over here. So anyway, I just want to kind of highlight Facebook. We got y'all up. I didn't put everybody on this one because y'all gonna have to stroll over to YouTube. So last week, every day, whenever I post, I always put those free books up there. So the free books are actually ebooks for you guys to use, especially those who cannot get those books right now. Yes, the books are costly, so that's the reason why I put the free books up there. Okay, they are ebooks. Some of y'all are not good with ebooks. You don't like ebooks. I used to hate them. I didn't believe in ebooks, but don't hate on the ebooks. I want y'all to use the ebooks. Facebook, and this is new for me putting y'all and chiming y'all in here because you asked for it. Okay. Get the links and get the books. Okay. I have free ebooks for all the classes. Now, today, I spent a lot of time revamping the YouTube to make sure that you're following the classes the way that they are numbered. Okay, all the classes are coded. I have three playlists. You see, I made sure I write it up there. I got three playlists. Okay, medical billing, medical coding, and the medical terminology. You will see the class code on there. I have 25 class codes. We've only been in three: medical terminology, medical billing, and coding. Those playlists have numbers on them. Okay, the medical billing course is course 83118. The evaluation and management course is 6101. The course number is 6101. It's the same across the board. If you go in Sapphire Academy, it is the same. I can't have all the courses as different numbers. Okay, that's the course number. All right. So I have not put that in YouTube. I decided to go ahead and put it in YouTube because y'all sending me emails that y'all getting lost. So I don't want y'all to get lost when y'all trying to find y'all work. Okay. The coding ICD-10 class is course. Okay, that class is 8313. Okay. Medical terminology class is 83128. Okay, the E&M 6101. So when you see those playlists, okay, you will see those course numbers. Those are my true class numbers from Sapphire Academy. All right, I put them on YouTube because a couple of y'all were getting lost trying to keep up with your work. Now I can put that in the playlist coursework, but I don't want to put it in the playlist coursework because YouTube has more control over that. Okay, just like them outside people who want to do my program and my courses. I don't deal with them because I'm the only one who's gonna have control over these programs. Okay, and one time I did that, and I mean these people literally had control over everything that I sweat and bread with. No, we ain't doing that no more. So I don't do that no more. So no collaboration with Ms. Lambert. Okay, so I have revamped the playlist, the regular playlist, so that you guys can find those courses. Now let me know if you get stuck and you can't find those courses. This is for YouTube, Facebook. When you guys go to YouTube, the courses is in YouTube. So these courses are free that are in YouTube. You need the Sapphire Academy for the rest of the resources. Okay, we get you ready for your certification. So that was a question that I got today too. Do you prepare us for our CPC? Yes, that's the purpose of me actually making this class. We didn't have the billing. I dropped the billing in there because people were lost when I say what's coding, but they tell me what the billing is. So I didn't want them to feel left out. I didn't want nobody to feel like, well, what else are we going to get? Technically, I'm steadfast on coding. The billing, I just threw that in there for people who wanted to take the billing. You can take your certified professional biller. That's fine. You prep for that too. So the books that you needed for that, I don't know if I gave you those books or not, but I can give you a link for that. Facebook, you can have this too. I'm still looking for a link. I had one over here one time before when I came on here, but I don't know where it is. I'm trying to figure it out. All right, so you do have to go to YouTube to get that. All right, I can put it over there on the side, but I'm not trying to do all that today. So let me see. We're gonna put this one over there because the reason why I want this one over there is because some of y'all don't want to do. Where is it? Some of y'all don't want to do coding. I don't know why. The coding is you got to work just like how you do the billing, y'all. It's not that bad. Judy said, yes, it is, Miss Lambert. No, it's not. Listen, everything is studying. Okay, everything is studying. This is it right here. This book right here. Everything is studying. I give you a schedule so you can set a pace for yourself. The reason that you need to set a pace for yourself is so you're not cramming, okay? And y'all know I hate to use Kim as an excuse. I'm only getting ready to use Kim because she crammed. She crammed. And now I don't care nothing about what school. They say she ain't go to school. She just studies. She just did. She just did. I don't care what she do. She just needs to study. Let me get back in here. She needs to study. Okay. Um, it's not easy. Okay. And nothing is easy. You have to take a test. You have to pass. I guarantee you. I don't care how many times Kim takes that test. She's going to pass that test. Trust me. Okay. So those are the two books y'all asked me for. I just put them up there. Um, that is the medical billing book. And then that's the workbook. So you see, I give away stuff. Y'all know I give away stuff. So don't say I don't give away stuff. Don't I give away stuff? Absolutely. So let's kind of get started. Y'all got any questions before we get started? And don't fret. Everybody take your books out. So y'all should have your step-by-step book out and your CPT book out. Okay, y'all get ready to archive this. I want y'all to stay on track. Okay, just stay on track. It's kind of hard, when you have to go to work and come home, or maybe you have the baby in the morning and you just have a busy schedule. I want y'all to just set 2 hours aside. That's all you need. When you do your hour here, your 2 hours is after me, because you remember you have your theory and you have your practice. I am your theory. The theory is me doing the class. The practice is you doing your reading, doing your tests, doing your exercises. Okay, whatever it is that you're doing at home, that's your practice. Okay, that's your practice. I don't know what that is. That's your practice. Okay, so the coding class, you guys know, is pretty long. There's about 60 classes in the coding. It's 60 classes because I am doing the classes an hour and a half, 2 hours a day. As you set your schedule, when I gave you a schedule, you're in the Sapphire Academy, your schedule tells you how many classes you're supposed to take. Okay? These classes are live. All the classes will always be live. But Sapphire Academy, you guys have a schedule. So being that the coding classes are 60 hours, we are on the 24th class. Okay? It's not going to be 60 hours, 60 days. I do class 3 days a week. When you guys are doing your studying, you're studying 2 hours after me. That's the plan. With YouTube, that's the plan for y'all. Okay? Sapphire Academy, y'all already know. Y'all do that already. YouTube, I am your theory class. Practice is you working at home. So if you do two hours, and then you all got the whenever y'all join the class, y'all know I always send y'all this. This is like your email, goes with your email packet, and it tells you how we roll. It tells you how we do the class. Okay? It tells you how you're gonna fit that 60 hours in. You should be working at least 3 hours, 2 to 3 days a week, something like that, to kind of fit the hours in. I have students that want to take their test, in March. I'll have students that want to take their test in February. All right, so we work around that. On the schedule, you have your own schedule. When I give you that schedule, put the date on it. So if you start today, let's say you started today, put today's date on your schedule. Okay? And then you're going to take it from there. Everybody is different. This is an open enrollment class. Everybody is different. This is tuition class, open enrollment class. You can start whenever you want to, because everybody is on the same page. If you start today and you go and you start looking at this, you're looking at this with me right now. Okay, I'm starting today, Ms. Lambert. All you have to do is archive the chats that we already did. That's it. You either can do that, or you can continue on with us, because it's going to be repetitious anyway, or you can work on your own. If this is chat, where we at? What is this here? If this is chat 24, so you got 24 chats to catch up with. So if I'm doing class today, we're not going to have class again until Friday. Okay, I might have other chats in between, and y'all know how I'm always kind of talking and throwing stuff in. But your days for chat is Monday, Friday, and Saturday. I'm trying to put it in here. That's your normal days for chat. Whether I do chat at 9 a.m. or 7, that's still your days for your regular class days for chat, no matter what. If I do chats in between that, it's stuff that I just go, wait a minute, I gotta let them know something. Or wait, I want y'all to see something. Like today, I was gonna do an extra chat today at 9 o'clock. But I hate throwing chats out there with y'all. Y'all know, bing, Lisa's coming on. No, I want y'all to know in days in advance when I'm coming on. So that's why I try to do it in days in advance where y'all know. Okay? So, again, coding is not hard, all right? I don't want to hear any coding is hard. If you have your CPT book, if you have your step-by-step book, that's why they call it step-by-step, because that's how we code step-by-step. So we get ready to get started. Let me see if anything I want to talk about before we get started. So we're talking about the classes are in order. You guys follow the course codes, okay? So you can stay in order, okay? Again, the playlist is arranged by date. So when you go into the billing playlist, it's by date. So it's going to land you, let's say, on the first class we did, the second class, the third class, the last class. That's what it's going to do. Okay, I don't know what that is. All right, so all of my classes, like I said, are in codes, you guys, and their codes and their numbers, okay? I always put the class that we're referring to here. So we're in class right now. This is what the class is, the cognitive care. That's what we're going to go over. Okay? So don't forget, if you guys join the Sapphire Academy, you get a syllabus, you get a schedule. You have to be in the Sapphire teams. I have to give you an email, and you get your one-on-ones. Okay? And I'm going to try to multi-stream, more than just a one-time on the multi-stream, because I know a lot of you guys want to do the multi-stream. Okay? So, but I would prefer you guys to get in on the YouTube, because you can't see the stuff that I'm getting ready to put up here on this OBS. So that's a little bit about that. So now we need to go ahead and get started. If you guys got any questions, do not forget, do not hesitate to ask me. Facebook. I don't have Facebook in front of me. I just can see the line up there that says Facebook in the red. I know I'm on. Same thing for y'all, okay? So like I said, I spent a lot of time when I got off to make sure that you guys can follow the course. Remember, I have 3 playlists. That's not a word. I have 3 playlists, okay? Just follow it like that. If you coming into the class, then you know that I'm going to shut the classes down in private, but I'm not going to do it yet, okay? This one will still be open because we're working on it. The other classes will go private. They're already in the Sapphire Academy, but they're going to go private here, okay? So if you're going to enroll in Sapphire Academy, let me know, okay? Go to the website, okay? Go to the website, okay? Hi, how are you? So this is medical coding class. Let me put my website down there because, like I said, these classes are free on here. And sapphire.com. We already up to our 24th class. Hi, Marilyn. That looked like Facebook to me. So we did invite Facebook today because I wanted to highlight my people on Facebook to make sure y'all get in. So this is the coding class. Marilyn, this is the coding class. We're not up to the advanced part yet. We just started. So we do medical billing, coding, and we do terminology. We've already done the medical billing class. We've already done medical terminology. I have 3 playlists. Those playlists consist of each and every class that we've done. The coding class is 60 classes, okay? It's 60 classes because we got to do all 4 points of the body, all 21 points of the body. It's preparing them, Marilyn, for their CPC. Go here, Marilyn, so you can see what the CPC is. It's Certified Professional Coder. That's what they're training to be. Certified Professional Coders and Certified Professional Billers. They can work at home or they can work in a facility. 9 times out of 10, if you work for a hospital, y'all already know you're going to be at home. When you work for a provider, he needs you to be his right hand. Okay, now y'all know I hire without the certification, and the only reason I do that is because if she passes my health information exam, I'm hiring her, and there are people who do that. So even if you get like halfway through my course and I give you those tests and you pass those tests and you feel like, Miss Lambert, I got it, I can do it, don't be afraid to put in for the coder position. Tell them you in class. This is a real class. Y'all get a certification. Y'all know I don't work no other kind of way. Accreditation across the board. If I feel like you ready, we're going to be ready. Okay, Carolyn. That's Marilyn. Okay, Marilyn. So if you want to get hired and you want to go in there, don't say no, I'm not going to pass this test. No, I'm not going to get this job. You can't get this job. Okay? If you already work in a hospital and you want to just kind of transfer over, fine. You can transfer over. You can go to the billing. Okay? Learn how to do the billing and you'll still be working at home. Okay? You do not have to be in there. I think there are pros and cons of working at home. I'm telling you, because there's plenty of times where y'all know me. I'm reaching. I'm reaching for food. I'm reaching for food. Y'all so much. I'm bigger than my sister now. I'm telling you, I'm cracked up. Yeah, I see the picture. I said, I ain't nothing. We did the ball thing. We did the ball thing the other day. But anyway, y'all know how I go off the bench. So take your books out. We getting ready to get started. So I'm getting ready to pull the book up, and those of you who are new, just jump right in. Jump right in like Carolyn did, y'all. Ask a question. See if it is for you. See if this is something that you want to do. This is a coding class, Code for Success. That's what it is. Okay, so I'm about to go in and we're about to get this book right now. I got to take Facebook off. I'm not taking y'all off. I'm just taking y'all out of my view. Okay, so my regular YouTube class, we can ready talk about cognitive, and we can ready code on that. So make sure y'all got your coding books out. Okay, make sure y'all got your coding books out. So Facebook, you can't see what I have up here, and it's because I don't know why it's because, but I don't see it. If y'all see it, good. I mean, if you don't, then y'all need to jump over to YouTube. Okay, guys. Okay. Thank you, Marilyn. Have a good night. And I know. That's why I did the Facebook. I want to see some of my old friends. This is a sweetie pie. She's one of my hangout partners in public school. So okay, so cognitive thinking. Y'all know the government always talking about cognitive thinking, and some of y'all, we did cognitive thinking in medical terminology. Then we do it in medical terminology, and we did autism. We did all kinds of stuff in medical terminology class. This is one that will be coded. Okay, this is one that will Instagram. Yeah, this is what's going to be coded. Okay, so I know you guys just started also Instagram me bringing you in. But I didn't bring you in last time. Who was it? TikTok we did last time. All right, well you gonna have to catch up. Okay, you gonna have to catch up. Right now, I just want you all to take your books out and let's just get to this page right here. If you got the ebook, go ahead and pull it out. I can put the ebook up there. So I'm gonna put the ebook up there for some of y'all who might not have it. Maybe some of y'all just started in my class and you do not have this book. So I know I just put the medical billing book. I don't know why this is doing that. Oh, is that it down there? I don't know. So anyway, I got it. So I'm gonna put this book there for you guys that want to and for some reason let me copy it. Okay, so maybe it is. Okay, so let me come back over here. And if you look at this description below, you guys can see this. So that's it. So that's a step-by-step book that I'm working in right now. If you don't have it, you guys can go ahead and put it on there. Hold on. When you do something and it is driving you nuts. Copy. I just put it there, but it looked like the other book. Is that it? Oh, okay. I just wanted to make sure. Let me see. Okay, so that looks like that. I just wanted to make sure that was it. All right. Okay, so we back. So cognitive assessment and care plan services. Okay, 99483. You guys can run over to that code. I'm gonna go ahead and put this up real quick. Run over to that code just to get an idea of what we're getting ready to do. Now we've already kind of went over some of this, but I still want you guys to kind of take a look at it so we're on the same page. Code 99483 reports assessment of and care planning for a cognitively impaired patient, new or established. Now, this depends on what type of facility that you're going to work in, that you're going to steadfast on this. This may not be on your exam. Go to aapc.com and look and see what might be on your exam. You're getting this because they may put anything on your exam, and you have to be abreast on some of it. So I want you guys to just, all you're going to do is just read this. That's all, okay? Look at the 99483 code, okay? The code description lists several elements related to the patient's cognitive history and or assessment of factors. Go get that audit sheet that I gave you guys from AAPC. I can't even tell you which one it is. Look in one of the chats and you can find that audit sheet. The audit sheet tells you what the key codes are, okay? It helps you with the coding with this. We're going to do a couple down the line so you guys can kind of get used to the coding. Now, we're still in E&M, okay? This is evaluation and management. But as far as the cognitive assessment, make sure that you know and you're clear on cognitive and you can spell that. Sometimes they have on AAPC, can you spell this? You know, how do you spell that? Okay, and that one looks like a doozy. Okay, if any of the elements are deemed unnecessary or not performed, a different E&M code is required. That's kind of like the one that we did with the 25 add-on on there, if they're like separate codes that don't have nothing to do with the other one. Okay. On the date of the encounter, typically 60 minutes of total time is spent with the patient. Assignment of this code by provider is limited to once every 180 days. So, I mean, if you're at a provider's office and they're doing orthopedics, they're not doing this. More than likely, a medicine doctor will be doing this, okay? So, again, we just kind of run through that. Care management services, go look at these codes so it can give you a good idea. But again, you know, whatever we do in the classroom, you guys are doing it at home, okay? You guys are going over this at home, okay? I want you to go to these codes right here, 99424 and 99427, 99427. So let me pull, I'm just pulling my book up. No, I don't want that one. I want this one. So again, you guys have the CPT book. You can pull this book up and look at what you need to look at. See, I'm passing through this. I don't even know why that's at the beginning like that. But when these books are set up totally different than a regular book. So you're going to have to, here, let me show you. Most of y'all that's in my classroom, y'all know how the books go. Here they go right here. See? And you see how we have to like kind of scroll over, and the other books we kind of go down. But again, you know, that's how you're going to find, your code. And the books that I gave you, this one, the CPT, goes all the way up to musculoskeletal system. Okay, it goes all the way up to musculoskeletal system. So Facebook, if you're in there, okay, get that book so you can look at it, okay? And now this is for people who, you know, don't know anything about coding. You might have opened your own business. You want to work for a doctor. You want to work at home. And again, if you already work in a hospital, this is going to be easy for you, okay? You just transferring, or you want to go to another department, you know, or you just want to kind of start something new. So I'm here. Can you guys see where I'm here? I'm going to put up in a minute. I'm here, 99395. Let me see what code was we looking for. I told y'all to go to 99424. Y'all went to the other ones, right? 99483. So wherever you're at in your coding book, right? Let me see where. So wherever you're at in your coding book, so mine's is, so I guess we left off at 99396. I'm heading over to the force. Counseling risk. Let me put it up because you can't see it. Well, you're supposed to have your book already, but this is where we are already. Counseling risk factor reduction and behavior change intervention. Okay, that's where we're at. We don't need to have the book up all the time because you guys already have your books. So that's why I don't really need to put the books up. Okay, so those were the guidelines. Everything has guidelines, okay? Everything has guidelines. You have to read them. Here is what I was talking about, the modifier 25. Y'all know all about the modifier 25, but I want to kind of throw that in there. You see all of this right here? I don't know who that is. You see all of this right here? These are guidelines, okay? This is what we was talking about. They are distinct from evaluation and management services that may be reported separately with modifier 25. We went over that before, but it's not only used with those E&M codes, it's used with other codes too. Okay, so these are pretty much the guidelines. Every single chapter has guidelines. Preventative medicine, individual counseling, preventative medicine counseling. We did counseling, 99401. Y'all supposed to have done that a couple of days ago because that's what we did. But if you look down here, look, this is everything in the CPT book. You see how it tells you how many minutes it is? So that's why I said the E&M services, office and outpatient, don't get scared with them. The book is going to tell you exactly what you're looking for. Okay, so you see how we're up to the fours? 994, see, 99402, 403. The whole book is derived like that. So even when you're doing your coding, when you're taking your CPC, everything is going to be in order. It's still going to be in order. So 99424. You see something like this, that means those codes was changed or they not in there. They were in there and they changed them to something else. They'll have the code down there. Just like this right here. This is what I'm talking about. You see the 99424, you see how it's red like that? It says code is out of numerical sequence C99487 99493 to 99493. And that's telling you to go back, okay? You see the same thing in a hard copy book, it'll be the same way. Unlisted 99429. We already did all of this. I'm just looking in the book, just going back. That's all we're doing. All right, so now I'm only supposed to keep that up for 30 seconds, but y'all know I can get carried away when I'm trying to show y'all something. All right, so let's finish with the E&M. I'm trying to finish with the E&M tonight. I know y'all, we've been at E&M for a minute. So care management services. So all those codes you're going to look up. The 99424, and don't forget it said those codes changed or they're resequenced. That means you got to find it in another spot. I think it said 99487 or something. Go there and you're going to find care case management codes, okay? Chronic care management services, same thing, okay? All of this is in a doctor's office or in a hospital where there is an office. Okay, doctor's office visits, because we are still in evaluation management. We have not done cases here. Okay, chronic care management services, and this is all it's giving you. That's why this is more than likely not on a test, but it's still here for you to look at. I'm more concerned about this one, cognitive assessment and care plan. I'm trying to see if it's giving you any tests. So YouTube, you guys don't have anything on this. The Sapphire Academy, you do. When you go in the Sapphire Academy, there should be some tests for you in there. All right, I'm just trying to see if they give you more. I don't know. It's such a small. So check this out. When you get to your CPC guide, this will be more. Let me show you what I'm looking at. It doesn't give you as much as I wanted it to give you, but it's enough for you guys to read. It's enough for you to read where you have a clue of what these services do and what they are. So these codes that we see right here, I still want you to look them up, even though it gives you such a small, such a small area. The cognitive assessment and care plan services, just read that so you can have an idea of what that is. That's your homework. You're going to read that, okay, with your CPT book. So when you open your CPT book and you go where we were, even if you're using the ebook, read the guidelines to that section and then look up those codes, okay? The chronic care management service codes, look up those codes. And it's just telling you, it says reporting of these codes. I'm not going to look at all of them. Requires the patient to have 2 or more chronic conditions that are expected. Remember the audit sheet? It's going to tell you the conditions that the patient needs to have, the severity of the conditions, to last at least 12 months or result in death. There is a risk of death or functional decline. A comprehensive care plan is established, implemented, revised, or monitored. I mean, you can tell it's be bad by I can tell by the codes where it's saying chronic care, invasive care with the patient. Like care management, we're managing the care of the patient. Complex chronic care management services. What does complex mean, y'all? I mean, what comes to your mind when they say something is complex? Might not be so easy, right? Might be a little bit of fickle up in there. Codes 99487 and 99489 report complex chronic care management services provided during a month. So you remember how I was telling y'all how we code the dialysis? This is almost the same way because it has a care plan. You remember the patient has dialysis, the doctor has to do a care plan. Go back over one of those chats. Let me see. I think it was the chat before this one. Remember we were talking about care plan? Same thing. It's just that these are different services. Principal Care Management Services 99424. Same thing in that same area. Remember it said you had to go to 99487? Go there. You're going to see that code in there. Okay? It's going to be kind of like below it. These services focus on the medical and or psychological needs of a patient, okay, with a single complex chronic condition that is expected to last at least 3 months. I'm not going to read the whole thing. You guys can read it. Let me see if we can put you in the right place right here. This I want you to look at, okay? In addition to compliance with chronic care criteria, there must be developmental and ongoing evaluation in disease. I know. I'm gonna tell you something. Who's that said? Oh, Miss Lambert. It's like I got to be the doctor too. Yeah. The more you read, the easier it's going to get. The more you read, the easier it's going to get. This book is called Step by Step because this is how they teach you. They teach you step by step to understand how we code or why we're coding. This is basically just the guidelines. So as we looked at the CPT book, right? Every chapter has guidelines. This is merely the guidelines. So that's why I say when we see these codes, you're also going to go there because the reading is repetitious. Okay? The reading is repetitious. Once you kind of get your index cards and get this down, you'll be fine. Okay? You'll be fine. So we're here, Principal Care Management Services. Go ahead and look up these codes. Go ahead and look up these codes. That's what we just read. We just kind of give you a little bit of idea of that. Now, differentiating principal care management services. These are the same codes that I told you guys to look up. This is in there. This is in the CPT book. They're just giving you this in the book because it is a step-by-step book. 99424, first 30 minutes, physician services. Okay, 99424, each additional 30 minutes, physician services. This is going to be in the record. This is going to be the record. When the provider is finished with the patient and he closes that case, that's when you get it. You can't code it unless the cases are finished and they're done. So you'll see in the record if it's going to be a 99427. This is going to be the description. Each additional 30 minutes, clinical staff service add-on code. In the notes, it's going to tell you that. It's going to tell you that in the notes. Okay? So when we get to documentation, I don't know if it's going to be tonight, but when we get to documentation, let me see. That's a little bit lengthy. I don't know if it's going to be tonight, but that's documentation down there. But we've talked about documentation a lot. If the provider has not documented, the situation that you're trying to code, it didn't happen. So what I tell my students to do, y'all don't think it's what it is. We've got to know it's what it is. So the hardest thing, I'll tell you this all the time, the hardest thing about learning and coding is taking your tests. Once you get out there in the field, you may be doing a specialty. You might might be doing only OBGYN. You might only be doing, orthopedics. But the CPC, you will learn how to do everything. Here in this class, you're going to learn how to do everything. Um, Look on the AAPC site. We did a chat on that. Look for AAPC review, AAPC chat. We did a chat on what's going to be on that exam. The gist of it is that you have gone through the CPT book. The step-by-step book that we're going over right now is going to help you to retain what you need. Okay, it's going to help you to retain what you need. There's no getting around it. In order for you to, I'm pulling mine up on my end. I'm on page 326. Sandra 326. Um, yeah. Okay. So no, if you got the older version, if you got the older version, if you guys have the older version and I'm on 326, yours might be on a different page. But Cindy, you got the new one. I just sent y'all the new one. The book that I sent y'all, the link that's over there, that's a new book. That's a 2025 book I just sent y'all. The medical insurance billing book, that's also a new book. So Facebook, y'all are new to this class right now. I give y'all free books, the books to the classroom, especially y'all who never did coding before. Again, this is a beginner class. We don't take anybody who, say, oh, I never done it before, I can't do it. No, this is the can-do class, okay? This is the can-do class. Sapphire Academy, y'all too. Even though, this is YouTube we talking to, of Sapphire Academy, y'all are on here. Let them know, that's what y'all send me 1,000 emails that I hardly can look at. I try to, but if we communicate on this thing, it'll be okay. Don't be sure to ask the question. Discussion board is everything. What is DB, y'all? Discussion board. Discussion board is Facebook. Discussion board is Teams. If y'all in Sapphire Academy, y'all know we have group huddle and discussion board. So, again, this is a beginner class. So we have medical billing, medical terminology, and coding. If you get stuck, let me know, because some of the codes are hard. Some of them are confusing. That's why we spend a lot of time on evaluation and management. The audit sheet that I sent you guys from AAPC, that's the one that we use. That's the one I want you to study by. Okay? That's the one I want you to study by. So on Facebook, you may not be able to see what we can see in OBS, but I think, you can also archive this and you can shoot over there and you can get the same thing that they're getting. But the gist of it is to make sure that you are doing the coding. We have exercises that we're going to do with this class. So that's why this class may be a little lengthy. Okay. So I do want y'all to do them. I want y'all to do them in the classroom in case y'all get stuck. I know a lot of y'all are doing them at home. I saw the files. Tamara, I got yours. Yours is in there. Okay, I already graded it, so you can go back in there and get it. So when you guys join the Sapphire Academy, this is for people who are not in the Sapphire Academy. You do get your own folder. You have to put your work in there so that I can see it and grade it. YouTube, you can't get work like that, but I've given you tests inside that medical billing, medical terminology book. Okay, y'all can go to Amazon and get that book. Okay. So let me just get back in here. I want y'all to kind of stay on track. And it's not that much in here. We did the care management services, cognitive assessment. Now, as far as detail and description of cognitive, we did that in medical terminology. So we're not doing that here. Okay, go back to the medical terminology class. Facebook, you want to see medical terminology class? Yes, y'all need to go on YouTube. Here is where we're doing the coding. We're not doing the what is cognitive. Y'all should know what cognitive is by the time we get here. Okay, so that's in the medical terminology class that we finished a minute ago. So you guys go back to that. No, I have not made them private. Brandy, they're not private. Go back over there and get it. Okay. So I'm not going back over cognitive, but 99483, y'all supposed to go over that. Okay, and it's pretty much telling you how you're going to code that. Okay, code 99483 reports assessments of and care planning for a cognitively impaired patient. If it is not documented, it did not happen. Because it's not like you just gonna be coding right off the air. You looking at the record to see what he got in there. Okay, look at his notes. Okay, um, if you guys are fortunate enough to work in a doctor's office with him, he's there, she's there. Don't be afraid of the provider. Query the doctor. Ask him if he give you something and he's got it in there and you steady trying to figure out, well, did he do this, did he do that? Don't spend 2 hours doing that. Go ask him. If you scared, go ask the nurse and tell him what Dr. Shaw talking about. If he comes in there and say, Miss Lambert, she changed my code. Y'all know what I always do. Okay, give me a few minutes. I'm gonna get right back to it. Okay? If he comes in there screaming, what are you gonna do? Tell him exactly what I told you. Then go get your supervisor. Okay? Go get me. Tell me I got him. Go get me. Okay? So again, I'll hire coders at 11 o'clock at night. Some of us on different times, and you have to get at them. You know what I'm saying? And then, they might have emailed the provider and said, I had to change a code or two. Okay. Then you have to keep explaining to him over and over because he want to build three things and then you only need one code. Okay. What is that? Upcode and unbundling, right? All right. I'm trying to get back in here, y'all. All right. I'm back. Okay. So, I get through though. All right, so we just kind of skimming, going over this right now. I want y'all to make sure y'all do hit this for homework. The chronic care management services. Now, look, like I said, this may not be strictly on your test because you're only going to have 2 or 3 in a certain area. Evaluation and management, you may have 5, or you may have 5 or 6, or you may have 4. Go to aapc.com and then it's going to tell you. Go to my chat. We already went over what's on that test. Okay. So again, Facebook, this is for certification, okay? And it's not only for certification. This is for, people who want to learn medical billing. This is for people who want to learn medical coding. Y'all go get my book, Medical Billing and Coding Q&A. Go get the medical billing, medical terminology book. I purposely put tests and quiz in there because y'all asked for it, okay? I can't put those tests on YouTube because those are my tests. I don't want no copyright on my tests, okay? So just kind of be precarious. Don't leave it open up on YouTube, XYZ. Now, if you guys are in the Sapphire Academy, yeah, y'all can go ahead and look at my tests in there if y'all are in a classroom. But I can't put my tests up on YouTube. But I have put my tests inside of a book. Okay, that book is copyrighted. You can look at it as much as you want to when you buy it. Go to Amazon and you can get that. That is going to help you with your medical terminology. That's for YouTube. So there are tests in that book. There are quizzes in that book for you to do if you have not joined the Sapphire Academy. Now, Sapphire Academy, it's not where I go in and kind of hold your hand. There's resources in there. There's you and I do one-on-one. You get your Sapphire email to get into the school. So, it's not like, I have to be in Sapphire Academy at 9 o'clock. No, it's the same thing. It's just like here. Here, we're on a schedule here because this is where the classes are live. They are here. Once I shut the classes down, they go private. They're going right in Sapphire Academy. Other than that, we are doing a Zoom because I have to do more. So we can only do a certain amount on YouTube. But when you guys join the Academy, the classes are longer there. Okay? And yeah, you don't have to get on our live class. You can archive anything you want. Everything is in order. Just like how y'all see how my YouTube is, those 3 playlists are in order. When you go to Sapphire Academy, it is the same thing. The only difference is when you go into Sapphire Academy, when you go to the coding course, you can, boom, you're right there to whatever you need to look at. Boom, right there, what you need to look at. Boom, what you need to look at. YouTube, you might have to find it, in the playlist, but that's why today I revamped that playlist to make sure you guys can get it easy. Okay, so I want you guys to also look up these codes that we just did, the 99424, 99425, 99426, and 99427. You will see that it is similar to what's in here. But again, we have to give you insight on what's going to be on that exam. Okay, how you're going to learn coding, period. Okay, So psychiatric collaborative care management services 99492. We're still in that same section. We're still in that same section. Okay, so codes 99492. You guys go ahead and look that up through 99494. Highlight codes that have almost the same meaning. That's why I told y'all to go through your book one by one. Pay. I don't care how much page you. One by one. Go to your CPT book. Okay. No, you ain't gonna do it with the ICD-10, but you're gonna do it with the CPT. Brian, if you got an ebook, well, as we studied the class, Brian, you can use the ebooks. But now when you get ready to take your test, if you're going to take it online, they're just going to kind of look at you with 360 camera. But you still have to have a hard copy. If you are going to take it in-house at a church facility or hospital, you need to have a hard copy. The proctor is going to look at your book. Okay, just make sure you don't have any stickies in there. These things here. Okay, so again, when y'all get your hard copy book, make sure you don't put any of these things in here. These you can put because this is your labels to label your page. Go to my website. I got plenty of those in there. They're already labeled. You don't need that little typing thing. They're already labeled. Go to my website. I got everything in there for y'all to prepare for y'all tests. Okay, so psychiatric collaborative care management services. Okay, and again, this is just getting you familiar with the different types of services that you may encounter. Okay, the code description lists several elements. We did that. Go back to the class so you can find out what the elements are. Okay, that must be documented in order to report any of these services. Okay, you still need the notes to do. You're not just coding off of an intake sheet. He has to have notes as to what he did with this patient. Okay, even though the patient may have her appointment is for this. Okay, at the end of the day, everything that he did has to be on that note at the end of the day, not when he first came there. Okay. In the initial month of collaboration consultation, a visit that lasts less than 36 minutes, remember we were just looking at the time, would not be reported. Is it up there? While a 36 to 85-minute visit is reported. Because y'all know if you have two codes and one is 15 minutes, one is 25 minutes, you can't code the 15 minute and 25 minute. You got to code the one that's higher. Okay? Y'all can DM me if y'all got any questions on any of it. So Jamal, if you're going into that field, yes. If you're going into a doctor's office that you may know that it's going to be behavioral health, yeah, I suggest you go ahead and do it a lot more because I'm pretty sure that there's an exam on it. Other than CPC, just like OBGYN, just like orthopedic, just like cardiology. You know, if you say, no, I don't want to do nothing else, I only want to do behavioral health, then you can work with a behavioral health provider and you're going to do behavioral health coding. That's what this is, what we're in right now. Okay. So we talked about that the other day too when we were talking about pediatrics and maybe you don't want to be a nurse, maybe not a doctor or something like that, and you want to do pediatric coding. You just want to be in that pediatric surrounding. Right, right. Okay, okay. Good. I know it's so weird talking. I'm talking, but you typing and okay. So we did care planning, transitional care management, but I still want you guys to go ahead and do that. Any code that you see here, anything you see this little area right here. Now, when we get to medicine, it's going to be a lot longer than this, but that's why I don't want you guys to get tired when you kind of see this. I still want you to look at them because on your coding exam, like I said, you don't know what they're going to give you on the coding exam. That's why they that's why they have you look at everything that's on there. Go to aapc.com and go to tests, and it's going to show you different exams that they have. Okay, it's already 7:55. I don't know how we got 7:55. All right, let's see what we can get in there. So let's go ahead and finish with this. Psychiatric collaboration, collaborative care management. You guys go ahead and do that. And remember, it's all going to go by minutes. And I just gave you the table up there, right? Okay. I'm on 326. Transitional care management. I want y'all to look at that. Advanced care planning, general behavioral health, integration care management. General behavioral health care management services are reported by a physician or other qualified healthcare professional. Y'all see that all the time. Y'all know what I'm referring to. Okay, at least 20 minutes of staff time are spent per calendar month. Now, here they only give you a little bit. When you guys head for the CPT, they're going to give you a lot more to look at. Okay, a lot more to read. Okay, but again, you got to go to Sapphire Academy to do all that. Okay, we'll go detail for detail. Okay, on YouTube. Okay, y'all got to go to Sapphire Academy for that, because we have a class on this. The class is literally 2 hours. The thumbnails that go in here are actually for the Sapphire Academy. Okay, they go in there too. Other evaluation and management services. I'm gonna put this up because I want y'all to see this. This is gonna be part of your homework too. So all the work that we just did today, all the reading that we did, that's what y'all gonna do for homework. Come over to Sapphire Academy, and then we can go detail for detail how this is going to be, but we can still do the practicing. Okay, I'm not going to give you the answers to the exercises. We're just going to kind of go over them, maybe one or two. Y'all got your CPT book and your ICD-10. Look on the side, I put those links up there. Look on the side, I put those links in there. Okay, hold on a minute. Other evaluation and management services. Okay, I want y'all to just kind of read over that. I'm on page 327. Let me put it up so y'all can see it real quick. And then the exercises are there, but we moved through it so fast I didn't realize that. Other evaluation and management services, 99499 is the last subsection in the E&M section. Y'all can go to that if you want to see it. Go 99499 is an unlisted code. If you can't find a code that you're looking for, the code can't describe what the provider did. That is used to indicate that there is no other code that accurately represents the services provided to the patient. A special report. This sounds like something that's going to be in a CPC. So just put this. I put this on the index card, and I want y'all to read this again when you go home. Y'all already home. A special report would accompany the unlisted E&M service code, because you can't find the code. You don't know exactly what it is. Nobody can find the code. You're going to use that, but you're going to send the notes with it, okay? Should be reported if the key components. Key components is in another class, okay? Key components is another class. Remember we learned about the key components? Okay? If you get stuck, let me know. And if you can't find it, let me know. Of an E&M service that does not meet the lowest level of a category. Okay. So here we are right now. Where we at? 1119. Because we was talking about that yesterday. When did we do that class? Was it yesterday or it was Saturday, right? All right, hold on. So I'm on the exercise page. I want y'all to get there. I'm just trying to get this page up real quick. I thought I had two up, but I guess I don't. So this is going to be your homework. I'm just going to put it up real quick. There's a lot to do, but I want y'all to kind of get used to the coding. Get used to the coding. We're still in evaluation management, so I want you to still kind of get used to the coding. The first one is a new patient is seen in the office for an earache, otaglia. The history and examination are documented, and the MDM. What is MDM, y'all? Medical decision making complexity is straightforward. The key components in the level of MDM. Remember, we had straightforward, high. The diagnosis was acute mastoiditis. Itis is what? Inflammation. Okay, so I want the CPT code. I want the ICD-10 code. What is the ICD-10? What is an ICD-10 code? The diagnosis and the CPT is current procedural terminology, the procedure. So what was wrong with the patient and what did the doctor do? Right? So you got 1, 2, 3, 4, 6, 7. Well, there's a lot to do here. Oh, you see these cases? These are regular cases. These are the type of cases you're going to see on that test. This is the type of case you see on the test. Look at number 11. See, number 11 is only, they just want the procedure code. Number 10, they just want procedure code. 8 and 9, just a procedure code, just a CPT. What did he do? Doesn't mean that he had to do a surgery, because we're not in surgery, so you know you're not going that above. You staying right here. I know I'm over. It's 8 o'clock. Yeah. Nah, the 2 hours is for Sapphire. I gotta jump into Sapphire. I'm late. I gotta jump into Sapphire right now. Um. So that's all I got enough of time to do. But your next class for YouTube is going to be Monday. It's going to be Monday. Okay, so that's what you guys are going to do. Like I said, if you want to join in Sapphire, go to my website, sapphirecoding.com. You guys can go ahead and go to that bookstore and you can register for one of those classes. Right now, you know, always have some type of low tuition going on for Christmas. It's $99. Go ahead and get in on that. You get books with that. The Language of Medicine also comes with that. And I've already given you all the other books that you actually need with the YouTube class. Join the Sapphire class so that you can get the test, the practice test, and you can get yourself prepared for the CPC. There's only a certain amount that I can do on YouTube. The purpose of the YouTube is to hopefully get you guys to join the Sapphire Academy, because there is where we have everything that we need and all the resources to actually teach you how to pass your CPC. Here, I chose to do the classes here because you guys were asking, and I felt that it was okay to do the classes here. I can only give you like 50% of what we actually teach. I teach a full blown out class, and we hands on. These exercises that's in here, we do them together. You guys are doing the exercises on your own. And again, if you don't have, in some of these books that they get, like the regular books, is like you have odd or even answers. I have the teacher's resources, and I can give you the answers on whichever one you want. But again, I can't do like a full blown class with YouTube. But you still have all of the classes. You have enough to kind of help you out, especially taking that test. Especially if you already know how to do coding, if you just need that brush up. If you failed that test and you just need to take that test again, if you feel like this is it, I'm finished. I did coding 10 years ago, and you want to come back, come back. Okay, and again, and especially for I have a couple of people in my class that actually did retire, that did coding back in when we did 09, no 9, what do you call it, 9, before 10. So you know, don't fret. You might want to do something else, you know. So don't hesitate to call me. Not physically call me, but you can call on the business one. Y'all already got that. It's in there. If y'all in the Sapphire class, physicians at sapphirecoding.com. If y'all want to send me an email, okay. I'm gonna put it right here. I forgot YouTube. You need to jump over to not YouTube. Which one is that? Facebook, Instagram. Y'all all right over there, right? Okay. So again, you know, I can only give you like 50%, 60% on YouTube. If you guys go ahead and join the Sapphire Academy, I can give you a little more. We also can do one-on-one. I know everybody like doing the one-on-one, but when we do a class, you know. Y'all got questions in Sapphire Academy. So those of you who are in the Sapphire Academy that's going to archive this, if you guys do need a one-on-one, let me know. So again, you know, we had a good time in a couple of classes a couple of days ago. But right now, you guys have to do those exercises. We can have a good time with it in Sapphire Academy. I can't do them here. But again, if you get stuck, let me know. I can go ahead and give you the answer to it. But we've got to understand how you got the rationale. When you look in the back of your book and you get those answers, I need you to know why it is that answer. So it's not just you getting the answers. These are not too bad though. I think they're okay. What you're going to do is revert back to what we just did. Before you do those extra, I know I'm coming 806. I know they're in there. I can see. Um, just kind of revert back to the care management and the cognitive, and you see where we did. Where's that right here? Let me let them see that. You see where we went over this section right here? When you go to your CPT book, that's what you're going to be looking at. Okay, it's going to give you a detail for in here. The test, those exercises that you see below there, that's where you're going to get them from. Okay. I forgot y'all were down here. Yeah, that exactly. That's what we're talking about. Okay, so mhm. All right. So I got to shoot over to Sapphire Academy, but thank you guys so much for watching. I don't know if we're going to. It's so much light right there. I don't know when we're going to do the Facebook thing. We just kind of threw that in there. I did Facebook Live a couple of days ago, I think, and y'all asked me to do it again on live on Facebook. But Facebook now, look, y'all gonna have to go over to YouTube, okay? I need watch hours on YouTube, so I need y'all to go ahead and go over there. But if y'all want, like I said, if y'all want to join the Sapphire Academy, let me know. It is not like y'all going to classroom. I mean, y'all literally are getting the work that you need to pass your exam. You can either download it or you can either get it from the academy. Okay, so we're gonna shut this down. I don't even remember how I shut down. How did I shut down Facebook? I don't know. Well, we'll figure it out. But we're getting ready to shut this down, and we'll see you back again Friday. Y'all see me? Y'all see me here on Facebook? Okay, so class is over. I'll see you guys next time. That other hour, I gotta go over to Sapphire Academy. I'll see you guys there. If you guys want to join the class, let me know, okay? And look at the rest of those chats. Look at the rest of those chats, okay? I'm just looking in here to see. I don't know why this didn't come like that. But if you guys don't have those answers back there, let me know. Because I might be able to do an extra one. I don't know. I was trying to figure out how I can put you guys in on that class. I don't know if it'll work or not, but I don't think so. I don't think so.